Thank you, and thank you to the ministers for being with us. Ms. Anand, if I could begin with you, please. Um, uh, we know that we are not producing any vaccine doses in Canada currently, and we also know that AstraZeneca agreed to allow countries who bargained it to produce its vaccines domestically. Countries like Mexico, Australia, Japan, South Korea, India, and others have done so and are producing AstraZeneca vaccines in those countries. Tell me, did Canada seek this right when we were bargaining our agreement with AstraZeneca?
Thank you, Mr. Davies, for your question. I really appreciate it. And I wanted to mention, first off, yes, I raised this issue personally with AstraZeneca last August. That was not an issue that they wanted to pursue with Canada at the time for the reasons that I mentioned in my last question.
Did they explain why, Minister? I mean, having given that right to so many other countries, did AstraZeneca explain why they would not allow Canada to vaccinate domestically when the National Research Centre has exactly the facilities and technology to do so?
The reasons were multifold, and I believe that you should ask AstraZeneca for a clearer explanation of that. But from my part, I believe it had to do with the scale of production that would be required in terms of building up Canadian manufacturing. And perhaps François-Philippe can jump in here if he wishes. But there was, and certainly I was raising this point that you're raising now, which is we would like to be able to manufacture here in Canada. By the same
So,
token, we wanted to make sure that we could ensure that we had the fastest route to the AstraZeneca vaccine, and the APA was indeed the fastest route as a result.
okay, thank you.
I'm
Now,
happy to add if you want, Mr. Davis, or
that's
not.
okay,
You
Mr.
decide.
Champagne. I have
Okay.
limited time, so I'll come back to you,
Okay.
but thank you for that. Um, Ms. Anand, if Canada is not affected by EU export controls on vaccines, can you explain why Canada is not on the EU export control exemptions list?
Thank you for the question again. It seems like great minds think alike, as I have raised this question myself. And it is indeed something that we are continually working with. I, of course, am the procurement minister, but I'm working very closely with Mary Ng, the trade minister, and Marc Garneau, our foreign affairs minister, on this particular issue. There has been a number of negotiations in order to ensure that our product can leave Europe. And so far, from my part, I have been assured from suppliers that indeed the vaccines will leave Europe. And I've been grateful for the work that Minister Ng and Garneau have done in order
Thank
to
you.
make sure that
If I may, have
occurs.
the Europeans given you any explanation for that obvious, very confusing list?
Me personally, no, but I believe that our counterparts are continually in discussion with the
Okay.
EU on this point.
Now, Minister Nand, I know you were a former law contracts professor, so I'm sure you've personally read each of the agreements that we have signed. Is that correct?
Yes, it is.
Um, so can you tell us what are the intervals of vaccine delivery in the Pfizer and Moderna agreements? Does it set out that we are to receive vaccine doses on a weekly, monthly, quarterly, or other basis?
Thank you for the question. Our vaccine contracts specify quarterly deliveries only. And the reason for that is, and I need to take you back to the month of August, early August, when we were concluding these contracts, that there was no sense of the timeline for the discovery of a vaccine. And indeed, in speaking with one of our suppliers this week, he said to me, we didn't know when a vaccine would be produced. And as a result, we could only commit to quarterly deliveries at the time of
Thank you.
contracting.
Fair enough. Mr. Champagne, you have said repeatedly that we expect to have the Novavax production before the end of this year. Now, I must point out this is not the first time we've heard this. On August 31st, 2020, the Prime Minister's office issued a press release promising production of 250,000 doses of vaccines per month starting last November, with millions, up to 2 million doses per month by the end of last year. Of course, on November 24th, he stated that Canada couldn't meet that because we had no domestic capacity production for vaccines. So, with respect, Mr. Champagne, why should Canadians have any more confidence in this latest assurance when the last one proved to be completely wrong?
Well, and thank you, Mr. Davis. And just for the benefit of Canadians watching, you have two different things at Royal Mount going on. You have the 44 million for the clinical trials, and the issue that you mentioned, which there was some issue with the certification. But now what we're talking about is a plant that will be able to produce 2 million vaccines per month. And I would say, Mr. Davis, when you have a partner like Novavax, that every country in the world would like to have, that they chose Canada and they chose Royal Mount, I think that should give confidence that we will be able to produce in accordance with the timeline that have been provided.
Well, when Prime Minister Trudeau said on
MP
I'm sorry.
Davies, unfortunately, you're out of time.
Thank
We
you,
will now
Madam
go
Chair.
to our next round of questions. Our